Hello, I'm Dr. Aidoo with the Department of Anatomy and Cell Biology, School of Medical Sciences, University of Cape Coast. I want us to look at the histology of cartilage and bone. So for cartilage, you have three main types, and depending on which part of the body you look at, the cartilage will be located as part of its function to its structure. So we have here the three main types, the hyaline cartilage, you also have the elastic cartilage, and then the fibrocartilage. So the three of them constitute the major cartilage components of the human body. So for hyaline cartilage, we find them usually at the articular surfaces of bones like this, showing the knee joint. So you have epiphyseal plate also containing some of these hyaline cartilage, which will undergo ossification if need be. We'll look at that later. Then in the trachea, you have that in the walls. Then at the ends of the ribs, where it connects to the sternum, you have the type of cartilage here, hyaline, connecting the bones to the sternum. Then they also form the template for long bones when it comes to endochondral ossification. So this is how a hyaline cartilage will look like. We will go into more details as we go along. So basically, this is how a hyaline cartilage will look like with groups of cells known as the chondrocytes within the middle portion of the cartilage. Then when we look at the second type of cartilage known as the elastic cartilage, as the name implies, it contains elastic fibers. So it's able to stretch. So which part of the body do you have this kind of stretchability? We look at the ear. And when you are in primary, sometimes your teacher will hold and pull your ear when you are proving a bit stubborn. The pain is lessened by the fact that the ear is able to stretch because of the elastic nature of it. Others are able to also pain their ears because of this elastic cartilage nature, all right, of the ear. You have type 2 collagen and elastic fibers basically in this type of cartilage, unlike the hyaline cartilage where you have only the type 2 collagen. So in the pinna or auricle of the ear, you find that. In the epiglottis, you also find that. The auditory or eustachian tube too, you have this type of cartilage. So basically, this is how it also looks like. Compared to that of the hyaline cartilage, you realize that the cells are not grouped so many in a densely populated, medial portion. This is a bit scattered, all right, with some fibers at the background. We will look at that in more details. Then last but not the least, the fibrocartilage is the strongest among the rest, and basically contains type 1 and 2 collagen fibers. It's usually located in the intervertebral discs, the pubic symphysis, and then where you have tendons and then ligaments. In the intervertebral disc, you find that in the annular region where it is circumferential. We look at it in details again. So for this pattern of appearance is a wavy or parallel appearance or design. This is how fibrocartilage looks like. So we should bear in mind these basic characteristics. So again, if three types of cartilage are displayed like that and you are supposed to name them, I'm sure based on the background we've had so far, you should be able to do that. So you have some cells in the middle portion, and then you have them, more or less grouped in twos or fours, sometimes threes, okay, with little on the background, okay, little fibers. You hardly see any fiber there. Compared to this one where you have the cells, all right, but the cells are more or less studded on top of each other in a parallel format with some fibers also running parallel, okay, and continuous, okay. So that is what we find here. Then here is like a mesh, okay, intertwined. So if you have a rubber band, a lot of them, and then you just pour them on the table, you are going to have something like that. Okay, so that tells you that there's some elasticity within it. So that is the elastic type of uh, cartilage. Okay, and then you remember the wavy continuous nature of the fibrocartilage. Okay, so this is how that would look like, and more so the cells within the cartilage are studded continuously on top of each other. Okay, and then for this particular one, you have very little noise on the background, but the cells are grouped together. And as we will see in due course, they are called isogenous groups. So this will be hyaline cartilage, that should be fibrocartilage, and that should be elastic cartilage. So again, emphasis. So fibrocartilage, you can see that the cells, which we call chondrocytes, are studded on top of the other. So you can even count them, 1, 2, 3. Okay, continuous. You have these ones too, continuous. That is that also continuous. They are not that scattered. Because this is a high power, and then looking at a very small area, you're actually not seeing the continuity and the parallel nature of the fibers and how uh, continuous they are supposed to look like. Okay, but at least you can see the cells are studded on top of the other. And for hyaline cartilage, they are usually concentrated in the middle, and then they are grouped, okay, together. So they form isogenous groups. So either two like that or three, okay, grouped together, or even more than three. You can have 4, 5, or 6, okay, grouped together, forming isogenous group. And the background is not too noisy, okay? It's quite flexible and continuous and then uniform. Then when you come to the elastic cartilage, you always have to look out for some extension, some mesh-like, finger-like projections within the background. They also have their chondrocytes, all right, but the chondrocytes are not grouped together in a uniform pattern like you find in the hyaline cartilage. So basically, we are building on differentiating between these three types of cartilage as we go on. So for a cartilage, basically for hyaline type, you have the outermost portion known as the perichondrium. Peri means covering or outermost, okay, around. So it's actually surrounding. So that is the perichondrium, which means that a similar uh, uh, type or structure like the perichondrium will be found on the other side of the cartilage if we extend this downwards, but this has been truncated. So you are only seeing just portions of the inner region. So we are traveling from here, which is the outermost portion, and then getting inside. So the P stands for perichondrion. The perichondrion contains perichondrial fibroblasts, which are actually cartilage type. So we call it chondroblast. Okay, anything chond is cartilage related. So chondroblast instead of saying fibroblast, but they are the type of fibroblast within the cartilage. All right. So as the chondroblasts, um, try to reproduce themselves, or as we will say, grow, they build up a lot of themselves on top of each other. We call that the appositional type of growth. So they lay down several chondroblasts on top of each other, okay, so that you end up having them lay down like a mat, or one on top of the other, and then they will start forming the chondroblasts themselves. So these are perichondral chondroblasts, okay, and then these are chondroblasts which have actually emerged from here, and then they are also flattened in nature. Then as these chondroblasts, which are the younger forms of the hierarchy of growth in the cartilage, they end up growing towards the middle portion. So here there's hypertrophy. So this is also a chondrocyte, which means that an adult chondroblast. So they are moving towards the middle portion. That is the matrix or the extracellular, substance down there within which the chondrocytes and chondroblasts are swimming or embedded. So that is perichondria with the perichondrial chondroblast. Then you have chondroblasts, okay, emerging from the perichondrium, and then these chondroblasts will keep on, growing towards the middle portion. So new ones will be laid down from the perichondrium here, and then old ones will be migrating towards the middle portion to grow and hypertrophy, okay, and become chondrocytes. So again, you can see here you have perichondrium on one side and then perichondrium on another side. So they will lay down the chondroblast, okay, by appositional growth, that is laying on top of the other. Then once they get to the middle portion and form chondrocyte, they undergo hypertrophy and then grow, okay, outwardly in the interstitium, okay. So that is how the growth occurs, especially in a hyaline cartilage. So what type of cartilage do you think this will be based on what we have seen so far? So that is the outermost portion, that's a perichondrium. You expect to have another perichondrium down there. Then you are laying down chondroblasts, which will mature to become chondrocytes. And you can see some of them are in groups. Okay, and once they are in groups, you should know that it is hyaline type of cartilage. So for hyaline cartilage, again, these are the groupings. This is a drawing, so it has started them on top of each other. Ideally, you find them, in a spherical manner, okay, grouped in a spherical manner, unlike this one, which are more studded on top of the other. So that is what you find here. So that is the circumferential, nature or spherical nature that they assume. That is the hyaline cartilage with the matrix. Then you have fibrocartilage. So they are more like running fibers. The collagen fibers are very, very conspicuous, and their fibers are running parallel, okay, with the chondrocytes also interspersed within them. This is the elastic type of cartilage, and like I said, you'll be looking at the background for some extensions, okay, or fiber like background. So that is the elastic fibers there. Those are chondrocytes, which will occupy a space known as lacunae for all of them. They contain lacunae, okay, so elastic fibers. Because of the collagen nature, that is how come you see the more reddishness of the fibrocartilage. So again, we have the perichondrium here, and here you have perichondrial fibroblasts, as I alluded to earlier on, osteogenetic progenitor cells, and then they are pluripotent. Okay, so they are able to divide and form many cells which can later differentiate, okay, so that you have the chondroblasts within the perichondrium here, and then they will now become chondroblasts here after they move from this portion, because new ones are being added, so it will push the old ones towards the middle portion. So that is what we call the appositional growth. And then they come to the inner part here, and then they hypertrophy to become chondrocytes. So again, for the perichondrium here, that's the appositional growth. So being laid down against the perichondrium. So it is laid down here, okay, all the way, and then they grow towards the middle. Because it is being added on, it pushes the old ones towards the middle portion. And they will undergo interstitial growth, okay, which means that they are free, they are not laying down on top of the other, they are free to expand, okay, radially, if you like. So that is interstitial growth, and it's also due to the hypertrophy that they undergo. So they enlarge, and then they grow to become old, and they are called chondrocytes. So they are mature, okay, mature cartilage cells. So in the trachea, which is a very typical example or site for hyaline cartilage, that is the lumen of the trachea, and that is the lining epithelium of the trachea. So we are making our way from the line all the way towards the periphery. So you end up having this hyaline cartilage ring. It usually forms a C-shaped ring, okay, when it is fully formed. But if it's not fully formed, it forms chips, cartilage chips, which will later on, join to form the C shape. And at the end of the C, it will be connected by the trachealis muscle. All right. So this is what we find within the cartilage of the trachea. So you have chondroblasts there, and then chondrocytes in the middle portion, okay, or the medullary region. And that's another chondroblast, okay, because this is a tube, right? So you find perichondrium on one side and then perichondrium on the other side. So you definitely have chondroblast there, and then inside the middle portion will be chondrocytes. So what are the borders or boundaries shared by the chondrocyte? Because of the isogenous group, they are able to have what we call their territorial matrix, okay, which means that around the chondrocytes, you have territorial matrix, just like their territory. Each chondrocyte has its own territory. Then you can also have interterritorial matrix, which means that the matrix bounding two or more chondrocytes or isogenous groups. So that is the interterritorial matrix, okay? So the matrix is actually the background, it's actually the extracellular matrix, okay? It's a connective tissue. So when we align the cartilages, this is what you find in terms of different staining. So this is one type of cartilage, but we are aligning them based on their different staining, ability. So when you have the H and E stain for elastic cartilage, this is what you are going to see. And always look at the background for fine mesh-like, extensions. And then this is a Weigert stain, which is also giving the elastic fibers even darker color. And that's the aldehyde fraction stain, also giving it this appearance. So that's for elastic cartilage. So fibrocartilage, as I said, they run parallel and continuous, and then the nuclei are usually, following each other, okay, headlong, more or less. And the collagen fibers are also running parallel. And it usually appears very pinkish or reddish in color. So that is how you find the fibrocartilage, very continuous, okay? So you can't mistake that for hyaline cartilage or elastic cartilage. So this is the vertebra, and in between the two vertebrae you have intervertebral disc. So this was the annular structure I was referring to earlier on. Okay, that concentric layer is a fibrocartilage which is able to cushion one vertebra from the other. Okay, so that the two bones do not meet and then cause a lot of friction and wear and tear. So you have this intervertebral disc in between them. Okay, so the nucleus pulposus is actually a remnant of the notochord. Now, this is showing how bones look like. So we'll be getting to bones very soon. So you should be able to appreciate how bone structure will look like when it is viewed under the microscope. So that is it. That is the fibrocartilage there and there. That's more of the nucleus. Okay, so we see how to appreciate the vertebrae and then fibrocartilage. So we now move on to bone. This is an example of a long bone. So you have the epiphysis, diaphysis, then have another epiphysis. So you usually have hyaline cartilage embedded there so that during ossification it becomes bony. All right. So that is what we call the endochondral type of ossification, where you have a cartilage laid down and the cartilage is converted to bone. Then you have intramembranous ossification, where there is a straight away formation of osteocytes, okay, right from the embryonic tissue. Okay, straight away. You don't have to lay down a cartilage before it is ossified later. So that's the different type of ossification. So that's the intramembranous and then endochondral ossification. So here you can see that there are cartilages here, cartilage matrix laid down. Then it calcifies, undergoes ossification to form a bone. Okay, and then when something goes wrong in the bone, you have phagocytic cells known as osteoclasts, which can resorb the worn out bones. Okay, so that is how bones also appear. Inside a long bone, for instance, you are going to find the osteon, which is this circumferential composite made up of the Herbacean, portion with the blood vessel, Herbacean canal. And then you also have the lamellae, and then you have the lacunae within which the osteocytes will sit. So the cells in the mature bone are known as the osteocytes, which will sit in lacunae in a concentric circle format, forming lamellae. All right. So when we look at it from the periphery, that will be the periosteum, just like we had perichondrium for the cartilage. You have periosteum for the bone, the outermost portion. Then as you move within, you have the osteon with the lamellae. So that is one lamellae, that's another one, that is another one, that is another one. Then you have this vertical canal known as the Herbacean canal, which will contain VAN and L, where the V will stand for vein, A will be artery, N will be nerve, and then the L will be lymphatics. Okay, to give nutrition to the bone. The inner portion of the bone will therefore be called the endosteum. Okay, so or endosteal layer, periosteal layer, or periosteum, then endosteum. The transverse canals are known as Volkmann's canal. They also carry blood vessels and then nerves. So this is how this will look like in a micrograph. HC is a Herbacean canal, the vertical running, canals with the van. Then that's the Volkmann's canal, the transverse running. Then that will be an osteon made up of the Herbacean canal with the circumferential lamellae containing osteocytes sitting within lacunae. And then you even have canaliculi, which are extensions which also help with communication and then transport of substances within the bone. So that is a cross section, and this is a vertical or longitudinal section. So another cross section, that will become one osteon. You have the Herbacean canal in there. All the black spots are osteocytes sitting in lacunae. So again, that is how you find this, the circumferential pattern forming the osteon. So that will be a Herbacean canal. You can have another osteon there. That is a lacuna, that's the white background, and then the dark spot inside will be the osteocyte sitting in there. And all these extensions are actually canaliculi. Thank you very much, and I hope this video helps.